Imagine trying to breathe through a straw while carrying groceries up a flight of stairs. For many people living with emphysema, that's what everyday life can feel like. Welcome to the Pulmonary Perspective. Today, we're talking about emphysema, what it is, what causes it, and what can be done about it. Emphysema is a form of COPD, or chronic obstructive pulmonary disease. It affects the tiny air sacs in the lungs called alveoli, where oxygen enters the bloodstream and carbon dioxide leaves the body. Think of these air sacs as thousands of tiny balloons. In healthy lungs, they expand and recoil with every breath. In emphysema, the walls of these air sacs become damaged and lose their elasticity. I often compare this to an old, stretched-out grocery bag. When it's new, it snaps back into shape. Over time, it becomes loose and floppy. That's similar to what happens in emphysema. As the lungs lose their natural recoil, air becomes trapped inside. This causes overinflation of the lungs and makes breathing increasingly difficult, especially during physical activity. The most common cause of emphysema is cigarette smoking. Years of exposure to tobacco smoke can gradually destroy lung tissue. A less common cause is alpha-1 antitrypsin deficiency, an inherited condition that can lead to emphysema even in people who have never smoked. Common symptoms include shortness of breath, chronic cough, wheezing, chest tightness, reduced exercise tolerance, and fatigue. Diagnosis often involves pulmonary function testing and CT imaging, which can help identify characteristic changes within the lungs. Although emphysema cannot be reversed, treatment can significantly improve symptoms and quality of life. The most important step is smoking cessation. Quitting smoking slows further lung damage and remains the most effective intervention. Many patients also benefit from inhaled medications that help open the airways, pulmonary rehabilitation programs that improve exercise tolerance, and supplemental oxygen when oxygen levels become too low. For select patients with advanced disease, procedures such as endobronchial valve placement may help reduce lung hyperinflation and improve breathing. The most important thing to remember is that emphysema is a chronic disease, but it is not a hopeless disease. Early diagnosis, appropriate treatment, and healthy lifestyle changes can make a meaningful difference. If you found this helpful, consider subscribing to the Pulmonary Perspective for more practical lung health education. Thanks for watching, and I'll see you in the next video.